stage our moderator, Dr. Kanthan. Yeah?
Thank you. Hi, good morning, everyone. Okay, so for our talk this morning, we're going to be talking about Dare to be Different, building a specialty interest clinic. Okay, so welcome everyone to Disruptive Doctors Conference and Exhibition 2025. And without further ado, let me introduce our panelists. Our first panelist, a hair restoration doctor and entrepreneur, founder and CEO of Hair Transplant Solutions and Aglow Hair. From DHI Medical Group to being president of DNI chapter to an aesthetic medicine trainer at the American Academy of Aesthetic Medicine to mentoring at Taylor's University, Bisphone. Please give a hand for Dr. Ali. Next up is an ONG doctor with an eye for branding, a heart for leadership, and a vision for women's wellness. He's the founder of Veloura Clinic and medical director of Imperial Asia Healthcare. Please welcome Dr. Shahrom. Next on our panel is the man who needs little introduction. I like to call him Dr. Prerna. He is the co-founder of Disruptive Doctors. He graduated from the University of Warwick. He had his early training in the UK, then came back to focus in the area of primary care, preventive medicine and healthcare innovation. Please give a warm welcome to Dr. Vivek Subramaniam. Thank you for having me, Vivek and team. I'm Dr. Kanthan. I'm also known as Dr. Gula, for those who know me. Okay, so just a little housekeeping. So if you guys got any questions, I like to keep this like a three-way conversation. So anytime if you need to disrupt us, you got something really good, please come and let us know. All right. Otherwise, at the end we'll have a Slido. How many of y'all are all GPs here? Is everyone here GPs? Well, most. Okay, how many of y'all are thinking about starting a niche clinic in the next 12 months? Excellent. Okay, we have at least one now. Okay, so we're here to unpack how a specialty interest clinic can thrive. Okay? So when you put us here, right, so you have a ball moderator and you have a hair transplant specialist here. Okay, so that's a lot of attraction here. So I'm going to give my first question to you, Ali. Okay, so
we're on opposing poles right now.
Yeah. So imagine you're sitting in your consultation room now, all right? And then walks in this guy, just like me, nice, bald head, a nice canvas to work on. Okay, what goes on in your mind? What do you start thinking?
God is great.
Okay.
God is truly great.
Excellent.
You answered my prayers this morning. No, but to be honest, I think when it comes to, let's say if anyone walks in, the first thing that always comes back is, why is he here? And what can I do for this person who just walked in? It will actually baffle me more. Why you, Kanthan, will walk in and see me? Because you look good without the hair. Really.
Thank you.
Yeah. And when you walk in, the doctor will always kick in first. So despite being a specialty interest clinic, we're doing clinic as a business, but the person who walks in ultimately is someone seeking a solution to a problem they have, and we as clinicians, as doctors, will still need to be a doctor and identify what it is that we need to do. And I think as the principle of being a specialty clinic is not about having to just be different, but it's actually just to make sure that you are in a segment whereby you can provide the best value because of this deeper seated interest you have in solving the problem, either as a whole or in the most microsphere that they come in with the specific problems with. So I think that's what will always go through my mind first. When you walk in, why are you here? And what am I going to be of value to you today? Let's have a chat. And that's how it starts. It's always let's have a chat.
Very nicely put, Ali. Okay, even with hair transplant, within the ecosystem, is there a niche within the hair transplant ecosystem that you focus on?
That's a very good question. So my niche when it comes into, let's say, hair restoration, although I do everything, from the diagnostics to doing medication, injectables, and assisting plastic surgeons in planning for the hair transplants. But ultimately, the biggest niche that I have that I really focus on is male pattern hair loss and female with high hairlines. When it comes to autoimmune parts, I don't. When it comes to skin diseases, I assist to manage. So I move very, very specific into areas that I can handle, and I'm really good at it. But areas which I feel, which goes into endocrinology, it goes into deep dermatological issues, I always do a co-counsel with all different specialties together.
So a niche within a niche is also a thing.
Yeah, niche within a niche.
All right. Dr. Azam, how are you doing today?
Still alive?
Excellent. Okay, I understand you had a traumatic brain injury, all right, just last year, all right? And you have to go through the whole recovery process. Now in 2025, in the aftermath, even as a second chance, all right? So how has the whole experience shifted your purpose in life and work?
Thank you, Dr. Kanthan. Hello, my name is Dr. Azam. Assalamualaikum warahmatullahi wabarakatuh. Like Dr. Kanthan said, yes, I had a lot of revelation for the past 1 year. Yeah, I've got dilemmas in my career path as well, whether to do clinical or non-clinical work. All right? So, but it so happened that I encountered a traumatic brain injury last year when I had a motorcycle accident. I had a severe traumatic brain injury. I was in the ICU for a week. But then they thought that I was going to be vegetative. They thought I was going to be impaled. But then I survived, alhamdulillah. And then for a few months I had therapy done under rehab and then I had a lot of revelations in my life. Whether I should continue doing my clinical works or whether I should go into a different path altogether. So, with my background of ONG, I've been serving the ONG department for the past almost 10 years. Yeah, so I didn't get a chance to further my master because of the my brain injury. So I had to postpone my studies. I had papers done already. So. And then there was time, a couple of years back, that I had a little bit of dilemmas as well, where I overcome it with continuations of my MBA. So I took my MBA in hospital management under Mahsa University because I thought, along the lines of my career, I want to do something for myself. I want to further my career towards the non-clinical parts, together with my clinical background. So I took my live episodes last year for myself as a new life, a new revelation. Maybe I should take this opportunity to bring myself towards a non-clinical path. So that's why I meet different people, seek opportunities, and then it came to my head. Maybe I should go into private sector where I can practice as an ONG doctor and apply my MBA knowledge and experience as well, so I can provide directly to to my fellow friends and families, especially and also in general Malaysians. That's what I experienced for the past 1 year, exactly 1 year, because I had the accident on the 23rd of October 2024, and now it's almost a year, and I'm here, sitting with the best teachers in the field. So I'm just feel grateful, Alhamdulillah.
And looking great, right? And looking great.
Thank you so much.
Okay, Ali. The education system in Asian countries are not designed with everyone in mind, alright? It is still very much rote learning. I understand you had 2 A's in SPM, okay? And was rejected by many universities. What was your drive to continue pursuing this career?
Okay. I think the drive was to be disruptive, as what Vivek would probably see me from day one when he invited me 3.5 years ago and say, hey, Eddie, join me, Disruptive Doctors. We're a bunch of doctors doing weird stuff. And I said, okay, let's do it. I never said no. Yeah, but, all right, so for those who are looking for weird inspiration, I've never been shy to say I am a 2A SPM scholar. I've got more A's in my full name than my results. And my dad says I'm an embarrassment to the family. But that's fine, because I think the drive now is not for him. The drive is not for someone else. The drive is, do I really want it? And if I really want it, then I will want to look for ways. We will want to look for ways to go and get it. So despite having that famous duka cita dimaklumkan, Anda tidak berjaya, blah blah blah. So say, okay, fine. Find alternative routes. I got myself into TAR College, started Form 6 to do STPM. But at the same time, I wrote appeal letters to every single university, all the way down to IMU. So even though I didn't apply, I just write in on it, I don't care. Just write handwritten notes, attach certs. Of course, PMR did better, but every single thing was personalized down. It was an effort, and I submitted each and every one of it. But I didn't wait. I just went straight into my STPM and started life. And 3 weeks down the line, I got a phone call and says, you know, it's a Tuesday. They said, if you are serious, we've got an opening, last minute opening. I think somebody dropped out. We got last minute opening. You have to report to Penang, so you have to drop all your life and go report for pre-U. And without hesitation, I just dropped everything, say goodbye to all my friends, and just pack up and left. But that spirit carried all the way through. So at any point of time, if there's something that we have that goal, please don't wait for someone else to make it perfect for you. Please don't wait for people to do handouts, hand-me-downs, or to wait for your seniors to guide you how to apply for certain things. You have to go and get it done yourself. And if you don't, someone's going to bypass you and you get very resentful. So, same thing. Transitioning it into private sector was the same. I served for 8 years in the government, and that's not short before deciding that I want to leave. But it's the same thing. Time to go, time to go. Need to break the bond and pay for it. Don't care. Just do it. There is never going to be that perfect moment. There's just time for refinement. I just attended a presentation yesterday, and the guy said, if you find yourself in a position whereby everything is perfect for you, you don't have to do anything, you just continue with your career path, means technically you went in too late. You should go in, make mistakes, refine, make mistakes, refine, and make mistakes. And I think that's how a 2A SPM story becomes a driving force from that time all the way to whatever I want to do now.
Very nice. Consistent and perseverance really pays off. Okay, Vivek, I got my question for you. Okay? My first question for you today is, did you get any sleep last night?
Very little.
Really. I think that when I woke up this morning, I saw an SMS, and the first SMS was from Vivek, and so it was something like 2 a.m., I think.
I probably slept around 4 a.m., so.
Yeah. Okay, Vivek, when I first met you, all right, you came down to Penang. I had hired your team to come and do basically to check a feasibility study, because I'm very much into diabetic care. So he and his team came down to do a feasibility study to find out about how diabetes can be done in my area and how things work. My question to you is, when you do your studies and so forth in the niche market, what is the 1 or 2 metrics that you look for? What's the data you look for to see for the feasibility?
Good morning, everyone. First of all, thank you for being here on a weekend. So, coming to your question, feasibility study, right? So, there are many areas, many factors that we look at in terms of feasibility study. I think in your case, in terms of opening a new practice, especially a niche practice, right? Focused towards diabetic care. And I think the things that we will be looking at is in terms of like what are the demographics, right? Demographics, in terms of like who are the population that you already been, because I think when we visited you in Penang, you already had a base of your patients, the diabetic care patients and all that. So I think in terms of like what are the other things that we can actually target for this patient itself, other than diabetic, what are the other things that can actually complement for that specific care, right? So I think these are the few things. Then obviously in terms of feasibility, in terms of the practice itself, right? I think going through the whole system of the practice, like from, I think everyone, I think if you have a GP, you know, GP is just the general idea, right? That's also, we have, what is that? It's broken down into multiple parts, starting from HR to finance to what is that, to inventory and all these multiple areas that actually doctors need to look at. But this is another thing, is like most, I think currently I would say the number is like still 70% of GPs in Malaysia are still practicing all this on their own, solo. Right? I think the previous talk we saw, Khairul was giving the talk on remedy in terms of providing the system. So these are the things that they're helping out the GPs in terms of like what are the systems that can be provided for GPs to actually, what is the word, make the system in a easier way for them to actually manage these things, right? So I think to answer your question, I think these are the few things that we look at, and also we will look at your finance as well, audits and all these things. I think that's about it, like, in terms of the feasibility part. Yeah.
So like any business, it's important to look at the viability of doing a business, right? Any contribution to you guys? Do you all see any other metric other than what Vivek mentioned?
I mean, like talking about niche market, like you said, it's true that I was interested with you saying yesterday that we have almost 12,000 GPs in Malaysia, right? That's the most recent data. So why are we doing another normal GP clinic? Why can't we form a niche clinic, a niche market, so that we can provide the best isolated or individualized service to the nations? That's how I think about. I think the same episodes occurred with Dr. Alice as well in terms of forming the Aglow hair change. So my niche was ONG. I can't even think of anything else apart from ONG. Yeah. So why not use my background and also my MBA to form a niche clinic so that we can reach more and more women out there? I'm not saying I'm a womanizer, but then it's true, because I think most of you would agree with me that most women would be shy to go to see doctors, yeah, for their women's problems, yeah, going to public hospital, going to public clinic, kesihatan. So we are always searching for our own clinic, our own doctor. So why not forming a change of clinic where we serve these women, yeah, so that we can provide the best service. We can always talk, we can always chat. Women like to chat, women is chatty. So, so we chat, we diagnose them, we try to look for their problems and give them the best solution, the best we can. So why not we can start it from the primary care itself. Primary care with a niche market of a women wellness. That's how the Veloura clinic come about. Yeah, so we want the people to know, we want the public to know, we want the nation to know. Veloura clinic serve the women the best they can. I can always rely on the Veloura clinic. I can always see the doctors, even though you're seeing me as a male ONG doctor, right? But my staff are all female doctors. My staff, my clinic assistant, my nurses are all female, because we want to create that bond. We want to create that bridge between the healthcare provider and the patients. Me, I'm just suggesting the best we can. But the way we serve, I've got my female team to serve the best they can.
I think to echo back to what Azam mentioned as well, I think, like for example, you mentioned about 12,000 clinics, right? Out of these clinics, like the numbers are like almost 80% of them are still doing the same thing: cough, cold, and flu, right? And I think the talk today is like basically to show what basically you see the market is moving towards. They need something more specialized, specialty interests, right? Because you can see, like I think you go nowadays to any row of shop lots, there's at least 3 clinics there, or maybe sometimes the whole row is taken over by a clinic. Right?
Vivek, I'm going to chime in on this because you're stealing all my points, so I'm going to just jump in. I need to appear a little bit smart up here together with you.
Come in.
No, but I agree with what you say. And one of the things is that I think I want to make this title, Thriving Specialty Interest Clinic, to be more relevant to our audiences here. You are GPs, but what does GP stands for you? Is it general practice? Because if you think you are general practice, then you are general practice. Means you want to pao ka liao, everything you want to do, fever, cough, cold, ONG, suddenly there's vaccination, I want to do vaccination, suddenly there's swabs, I want to do swabs, everything that comes to your plate, you want to take it up. So you are a master, you're not even a master, you're a practitioner of everything, but a master of none. So as what Vivek said...
Now you took over my point.
Now you fight.
That was my line.
Okay, your turn.
Yeah, I saw that in his message.
My 4 a.m. message actually had that.
You didn't text me, I didn't know. So anyway. None of this is scripted, okay? But what Vivek says is true. If a patient is standing on a shop lot and there are 3 to 4 clinics there, I wouldn't know which one to go to.
No, you throw a stone.
Throw a stone, flip a coin. Or you see which one got more queue and you have time, you say this must be good, I will go in. Or you say, I got no time, I go to the one that is empty. Or you go to the one and says, the counter fuller not nice, I'll go to the next one. Or you walk in, oh, it doesn't smell very good, not very confident, then you walk off. Now you see what happens to your general practice. You have boiled down to people selecting you not because of your skill, not because you have something special, not because of anything, but it's chance and convenience. You are now a convenience practice. And I think that should not be where GP should be moving towards. I think GP should be moving towards certain other terms like generational practice, whereby you are so specialized in something that generations will come and see you. I would always remember this one doctor. So when I was much younger, my babysitter was in a very small kampong. And there's one doctor, his name is Dr. Siva. We all know him. There were 5 GPs in that small kampong already, but Dr. Siva was known to be the one that can treat any type of cough, and only cough. If you go there with backside pain, he will say, please, it's always injection. But if it's cough, he will give you something that by 24 hours you're back to school. And I hate going there because we must go back to school. I would rather go get injection and stay, take the 3 days MC. But coming back, as a GP, generational practice, find a niche that you can try. If you want to focus on asthma, be really good at asthma. If you want to focus on eczema, be really good in eczema. You can still do the rest, but you are known for that one thing.
Yeah, that's exactly where I wanted to go next with our conversation. Alright? So, you can't just open a niche market, being a GP, just coming out from undergraduate and you like, oh, you know what, I want to open a niche market with this. It doesn't happen that way, right? Before you open a niche market, there's going to be work that you'll have to do. You'll have to get yourself trained and upskilled, alright? So, Vivek, tell us more about this.
I knew that it's going to come to me.
You get started.
So, I think this is something that I talk about all the time. In terms of, you need to create a differentiator point. And I think similar to what Ellie said, the niche. What is your differentiator point compared to all the other GPs that are around you? So how do you do that? I think this is something that doctors actually know very well in terms of upskilling. But the only upskilling they know is MRCS, MRCP, dermatology, LCP. But to be fair, there's many of the other areas. Like I think one of the things that we are doing in Disruptive Doctors is bringing more upskilling courses, specialty interest courses. So men's health, hair, female, diabetic care. So I think all three are sitting here are like my examples, right? But doing this upskilling basically gets doctors to be able to provide this care. And when we say niche, right, we're not saying people who come with cough, you chase them out. That's not what we are saying. Except probably Ellie's clinic is fully focused for hair. So if you go there with a long hair, probably he's going to kick you out.
I still know how to treat cough.
You sure?
Yeah.
So I think it's about upskilling. I think that's one of the biggest area that we want to actually get our GPs to focus on. Don't try to upskill everything. I think this is what a lot of them do. When they come out of KKM, the first thing they do is the first 4 courses. Occupational health. I don't know why. Everyone goes and do a NIOSH occupational health. I'm not saying don't do it.
That's because everyone wants to go into oil and gas.
But most of them are not going into the oil and gas, right?
The hope is there.
Yeah. So they tend to basically use a machine gun strategy, right? Just shoot everything. And this is where I think you stole my line. Basically, everyone wants to be jack of all trades, right? And what we want with specialty interest is master of one, right? So at least something that they know, okay, this is the doctor's differentiator point. See, when you come and, if Kanthan asks me help with his hair, I'm going to say, oh, Ellie is there, right? For you, I'm not going to help you with Kanthan. But yeah, this is how I feel like doctors need to move towards this. Like, there's already 12,000 GP clinics are already doing the same thing. If you go into the market doing the same thing, how are you going to survive? Simple as that.
Thank you. What about you guys?
Well, I concur because when I left ministry, that was 2010. It was 3,500 clinics only. So over the span of 12 years, 13 years, another almost 2,000 clinics have emerged. And if you are just going to be competing on the same leveling ground, you are basically just grinding each other down to earth and putting yourself, nailing each other's coffin one by one, you know. You think you're nailing 5 fellas, but 5 fellas are nailing yours also.
You know, something I noticed, right? So, talking to a lot of my GP friends, they tend to go, you know, one day they'll do this, one day they'll do another one, another day they'll do another one. is there any tips on how to find which, does your heart just take you there? I know for me it was very straightforward. My heart just took me there, It's just, I knew what I wanted to take care of. So, how do you find that compass?
Let's ask Azam first.
Wait.
How he got so focused in ONG? I'm very curious also.
Still a disclaimer, I'm not a womanizer. but
You keep saying that.
But initially I was supposed to go into anesthesiology, yeah? But then I have this interest in myself that I like to deliver babies. That's the only interest that I had before when I first finished my housemanship. I like to deliver babies. It's always a charm for me to see another life being brought up into the world. Yeah, to see the happiness from the mother's faces, from the father's faces. Yeah? So this is how I continued myself in the ONG until now. And then along the way, I realized there's a lot of women's problems that need to be solved. Yeah, women are complicated, if you may agree. My wife is just shaking her head. But yeah, women are complicated. Yeah, so because the hormones runs throughout the body, and then there's a lot of hormones that need to be settled every month. Yeah, so that's how I involve myself in the ONG, because there's a lot of problems that can be solved, and then it's always a charm to see a male ONG doctor trying to solve female problems.
Looking at Dr. Azam, you already have the answer. When you're finding a niche market, you got to have passion, right? So you find your passion, you're most likely finding a niche market as well.
I think to answer that as well, I think most of the people here, I don't know if you all read this book called Ikigai. I think I found this book very interesting, and I think it helped find my purpose, my why, right? Why am I doing this? And I think when you guys have a very strong purpose in terms of what I want to do, and you will basically realize you'll wake up every day excited to do it, regardless how difficult or regardless whether you sleep at 4 a.m. in the morning. You still wake up saying that, okay, this is going to be a good day, right? And I think that's like what Kanthan said as well, is passion, right? And because when you have a purpose and you have your goal, I think it's all fun already. Like I think the fun that we're having in this panel as well.
Yeah, I think Ikigai is a very good book for those who want to pick up something to read. Another one that's really good that I found very inspiring is by Simon Sinek, Start With Why. Start with why. We always start with what I want to do, how I want to do, but never ask yourself, why do I want to do that? Okay? And one of the things about finding passion, it's always easier said than done. I've been in GP shoes. I have four GPs before I close most of them down. It's easy to say, let's go look for the passion and let this passion guide you to which niche you want. But if you don't know how to do it, you won't discover your why. So what I found useful as a tool that you can apply is talk to your patients. Ask them, why actually you come and see me? What is it about me that you have confidence with, number one? Or, number two, can you tell me generally why doctors are not very effective? And see if their answer can give you a purpose. For example, in what I do now in hair, it's not something that I was born with and said, oh, I want to do hair. It's the weirdest thing to do. It was never in medical school, one chapter on hair. Nobody cares. It's a small 5-minute lecture within the skin of your dermis. So hair is not a curriculum. But along the way, where I found purpose was when I talked to people and when they said, oh, you do hair, are you like this shop, that shop? And I said, I'm not. Then they said, then what do you do? Then they start telling me how they got hair problems, they got diagnosed, and then they sign up packages, 8,000, 10,000, 20,000, got up so many times, to the point whereby they are fed up and they don't want to go. I've met patients who said they took personal loan, 40,000, and can't do anything, and come to see and say, Doc, can you do something for me? I got no money for you. But that drove a purpose. That purpose says today and onwards, I want to do the best diagnostics for my patient. Today and onwards, I want to tell my patients who walk in, you have hope to grow hair, or you have no hope to grow hair and just be handsome with no hair, or go buy yourself a Rolex watch. It's cheaper and more fun. So you can, it's that kind of purpose that drives the why in me to do what I want, and from then onwards, the technology, the methodology is all just part and parcel, but that why is what every one of you can do, but you need to talk to your patients. Ask them what is it they don't like about doctors, let the answer resonate, that can you fill that gap? If 10 people say the same thing about one issue of doctors in general, can you fill that gap? And if you can fill that gap, you are already a specialty doctor.
Very nicely put.
Having said that, I would just like to echo and concur with Ali's point. I mean, each and every one of us has your own specialty. I'm just going to talk from the GP's perspective. Yeah, you know GPs do a lot of things, want to do a lot of things, but you yourself individually, you know what you are capable for, you know what your forte, you know what your specialty. For example, for my slides, patients always like me to deliver their babies because I like to have my labor room as quiet as possible. I don't shout, I don't scream. I just say, Mama terang sikit je boleh nak keluar dah. And then the baby in his house, everyone says happy. I don't like to be shout to patients and all. And then and during counselling, I even tell them, I counsel them bit by bit, one by one, on how you can always see vaginal delivery is always the best. It's always better than cesarean sections, and they always conquer. They always want to deliver them, their babies vaginally. So that's my specialty. That's how I want to pursue myself in ONG. That's why I want to pursue myself in the niche market of women wellness. So from the GP's perspective, you yourself know yourself. You know what's your specialty. You know what you're capable for. If you know diabetes more, then treat the patient diabetes as many as you can, and then provide the best treatments for them as long as you want. That's how I see myself.
Nice, thank you. Okay, so from specialty clinic, I'm going to be talking a little bit on how to make it thriving. All right, Ali, I understand you have 500,000 followers. Am I right?
I like to not wake up from that dream, but yeah.
Excellent. Okay, my question for you is, on acquisition engines, rank your top 3 that works for you. Is it organic, referral, paid ads, community, or perhaps even partnerships?
Out of those, I would say number 1 is referrals. Referral is the most cost-effective and highly convertible way of getting your sales in. Because one good word of mouth is worth 100 leads coming in. And you don't even have to pay for it. You just have to build relations with that. So number 1 is always referral. And referral only can come in if your patients or your referees feel that you care. Right? So if you care, they refer, you're happy. So referrals is number 1. Number 2 is SEOs. I would say SEO works well for me. But again, you need to know your own clientele. My clientele are searching on Google. So for me, the SEO comes in. Paid ads is actually quite further away for that service. But in different segments, paid ads will work. All right. But more importantly, I would say out of this whole thing is to build your personal IP. I think that's the one that really starts to drive in today's market. We can't run away from building your own IP anymore. Even if you say you're camera shy, you have to do it. I got this example from a friend of mine whose wife was helping to do his IP, and they told me, Doc, let me teach you a couple of things that you need to appease the Gen Z crowd. And I said, number 1, why I want to appease Gen Z crowd? They're not my customer. Then they said, Because they say, how? But before that, I asked how. Then they said, Doc, please stop talking like this. Please stop sitting the way you sit. Then I said, how should you do it? This is how you should do it, Doc. You sit like this and you talk. When you pose, you don't pose straight. You got to pose like this. That's not me. But that's weird. But she says, you have to start doing it somewhere along the line. Then I said, why? Then she gave me a great example, simple example. She said, Doc, your parents' time likes P. Ramlee movies. You like Marvel movies, correct? I said, correct. During your time, if your parents want to watch P. Ramlee movies, are you going to follow? Or if they put P. Ramlee movies in TGV and GSC, will you go and watch? I said, no. But if they put Marvel movies, do you think your parents will watch? And I said, yes, no choice. Then they said, Doc, today you are P. Ramlee. I'm P. Ramlee level already. If I still want to put what I want to watch for people my age to watch, no one's watching. The younger generation is watching. You need to follow the content, the style of what they want the message to be delivered to them. And don't worry about your older patient. They will still watch, because there's nothing left to watch. There's nothing left to watch. They will still watch. The old one will still watch all these funky ones. The old ones are still going to watch all this drama, all this comedy, because there's nothing left to watch. But the young don't watch you, you are no longer relevant. So, very long question, very long answer to the question. I will go referral, SEOs, paid ads, but personal IP needs to be there, and the worst part about personal IP is it doesn't convert sales so easily. It just builds trust. You still need to do the rest, you add the personal IP. Don't do your personal IP and say, oh, I've done it for like 6 months, nobody's coming, I'm frustrated, what do I stop? Then you're actually going backwards.
Coming from general practice and moving on to a niche market, one of the main things that probably helped to drive, make it more sustainable, more profitable, was your operation cost goes down. Because as a GP, you try to do everything. You start keeping everything. You try, I can get all your equipments which don't generate income. So when going into a niche market, your OPEX definitely comes down relative to what you make, right? Vivek, community as a funnel, right? You built a nice community here already. What percentage of attendees actually convert?
Good question. I probably don't know. I think that's handled by my partner Selina.
But looking like you're converting quite well.
Yeah. I think total registered today 500 participants.
Nice.
So I'm very excited. I'm especially to see a lot of doctors are actually excited to know what are the new things in healthcare, what are the future holds and all these things. But I think in terms of, I think these are the questions I think you should probably give these two guys in terms of conversion, because I think they will probably give you more from a clinic perspective, because I think my perspective when it comes from a disruptive doctor is very different, because it's a community-based thing, right? And we do I think majority of our conversion actually comes from organic, almost close to what, 80%. 20% is probably from paid marketing and all that. Because I think in terms of community, it's like the tribe of disruptive doctors are working basically to spread the word. Right? There's always people who actually got something out of disruptive doctors sharing the word to others. And I think that's how we grew from, I think when we started in 2020, we had obviously very few doctors joined us. And now we have close to almost 5,000 plus doctors, 5,000 plus
very well
doctors
done.
in our platform, yeah.
Please give disruptive doctors a loud. Okay, Azam, when building a specialty clinic, how do you balance the depth? How niche do you want to go versus the breadth to offer, all the complementary services? What is your thinking in that?
This is how I see it, because I've been in the industry, I'm in an ONG specialty for quite some time, almost 10 years. And then, so of course, I've got my network of ONG bosses, yeah, specialists and consultants that are still residing in the public hospital as well as the private hospitals. Yeah. So for my locations of clinic right now, so of course I try to search my network. Yeah. I can't be fulfilling all the services in my clinic. Yeah, because GPs we have our limitations. We can't do a lot of procedures in the clinics. That's why you have to have your own network. If you are new doctors, new medical officers, you just had your housemanship done, but you have your friends, your other friends, yeah. So spread your wings. Try to get them attached to you. You can always advertise your specialty services in your clinic, but in the end, you still have your networks to do all the end treatments for you. For example, you screen for cervical cancer, yeah. But of course, your Pap smear, your HPV tells you something. But follow-up of that assessment, you still have to have your biopsy taken, your labs, your cone biopsy, to be done in the proper center, like hospital or medical center. So that's how I build my clinic. I know my specialist is there. I know my specialist is here. So whenever I have my docs, whenever I have my continuity of treatments, I will boss them. Please, I have this one patient, can we assess it here? And then afterwards, I send it to you. I have my detailed scan done here, I found something. Okay, just try to confirm it, do the genetic testing. That's how I run my clinic.
I just want to add on something as well. See, I think that's a very good point that you brought up. In terms of GPs, most of the time they are feeling very lonely in the practice. Because sometimes everything needs to be managed just by themselves. Right? And I think the point that you said in terms of having specialist support and all that is something going to be very useful in terms of if there is something that they are not sure, there's always someone to actually refer to, right? In terms of not just referral alone, but to check. By the way, I need advice on this. And this is something that we are actually, from Disruptive Doctors, we are actually planning this for, we are looking at launching this next year in terms of getting the GPs and specialists to have a better connection. Because in Malaysia, we see the gap is quite large, right? When I used to practice in the UK, the gap was much lesser because NHS has a very good network where you have the primary care and the secondary care working together very closely. But in Malaysia, the gap is super big. And one of the things that I'm trying to do is how do I bring this gap smaller and smaller every year? Yeah.
I'd like to echo in that. I'm not sure how I've graduated since 2004, so that makes me quite old. But during the time when I was still in government service, things that we always hear when patients come into hospital. Then we see the referral letter, then the specialist or the MO will say, managed by this GP again. Pandai-pandai about all this. I think that if you look into your current practice, do you have that fear? Are you still afraid of these people judging you, of your management? So you either don't manage, or you manage it, or you're very scared to refer, or when you refer, you don't even write your name. Because you're very afraid someone up there in the government clinics or in the government hospital will say, this Dr. Vivek lagi, sending this, Dr. Kanthan, pandai-pandai nak jadi endocrinologist.
No, that's why the doctor's handwriting cannot be read.
Yeah.
Cannot read it.
Just simply right? But I think that is a limitation point. And if we don't get out of that limitation point, it stops you from growing. And as doctors, you need to grow. And what Azam said, Vivek said is true. We need to start working with specialists. Today's specialists, especially in the private sector, is very different compared to the ones 10, 20 years ago. 10, 20 years ago, they may judge you. Today, they actually want to be your friends because they also are fighting for their own survival. And the only way is to work together. And if you find there's a specialty interest that you have, the next 5 people you should hang out with should be that specialist of that area that you want to specialize in. And you go with the humble attitude of saying, I'm not trying to be you, but I want to manage it at a primary level. Can you guide me? At which point should I send them to you? They will, from my experience, they will guide you. And they will send them back to you later. If we have this scarcity mindset, if I send to you, they'll never come back, then you will never grow, because you don't want to grow, you don't want to work with someone else. So have that growth mindset. I work with plastic surgeons. I work with multiple plastic surgeons to grow my practice so that I can scale, so I can upskill. I get plastic surgeons referring their patients to me. I've got plastic surgeons who wants to do transplant, and me and my team have done it on the plastic surgeons. I mean, a plastic surgeon needs a hair transplant, we're doing it on a hair transplant doctor, on a plastic surgeon. But that builds a community, and from then onwards, when I have issues, I will ask. It has to be two-way. We cannot go back to the old system of takut orang cakap, ya, doktor ni mana lagi, ya, tak bagus, refer, pandai-pandai lah you. That should be out of the way. Remove that and grow.
Definitely. I mean, I manage a lot of diabetic wound cares, so mainly on the foot. So we definitely need to have my orthopedic guys on standby, the vascular surgeons. So when you're doing a niche market, you definitely have to go and look up your specialists around you. You learn from them as well, and you'll be referring to them, and they will be referring back. Because, you know, diabetic foot care, when they go to orthopedic, I cannot pay you this rate anymore. So, okay, time to go and see your GP, you know?
Yeah, I agree. And just coming back, just one quick point when we touch back about all this social media and videos. Like in Aglow here, I work with Dr. Jimmy Yo. We do videos together. We do content together. And I think as GPs working with specialists, you can do content together. You do a banter. You talk from your perspective or what your patients are asking at GP levels and let the specialist answer. It works both ways. Your specialist will be very happy to bring you up to the level also and says, if in your community you need anyone to see, please see Dr. Kanthan for your ruler. Please see Dr. Azam for ONG related matters. Gone are the days where people are actually trying to put you down. If we don't try to bring each other up, then the only other way means we're bringing each other down.
I think, thanks for
Emotional, right?
that point.
Emotional.
Yeah, very emotional. No, but I also wanted to bring up a point in terms of like a bit on when you become like specialty interest and all that, the part about branding yourself and all that. And this is where I wanted to bring up like Dr. Kanthan as well. Very well branded into Dr. Kanthan, the Dr. Gula, and he has his own hashtag and whatnot. I think you guys can search it, right? I think we got Dr. Hair as well. I don't know what to call him though. If I say something, it's going to be very wrong.
I just had my clinics run for 3 months now, so I'm still new. I'm still new in the market, but you can search for me.
Ali, control yourself.
Hashtag non-womanizer.
My wife is going to scold me all the time.
Very nice. Okay, before we end, is there anything that you guys on the floor want to ask? We'll give at least one question. Nothing? Okay, so our time is up. So firstly, I would like to thank the speakers. You guys were wonderful on stage, you know. It's very light-hearted, and I hope that the crowd here managed to get some information. So now, at the end, how many of you want to open niche market clinic? No one? Oh, we got 2. From 1, we got 2. We got 3 now. Okay, 4. Okay. At least you got 3 extra people.
See you guys in the community.
Okay, guys. Thank you so much. So I'll leave it to the speaker.
Ladies and gentlemen, once again a big round of applause to all our panelists on stage for the forum. Quite interesting, quite insightful as well. Let's have a group photo.